Okay. Welcome to stockmarketfunding.com. Here it is, www. Call us. We are professional traders, run a professional trading school, but we also do a lot of other things that we are masters at, just as we are in trading. And basically, it's time for you, America, to open up your eyes. It's time for you to understand this health care bill without voting on it. And basically, I will tell you now that if the American public is not, and here's some of the stuff about Pelosi here, and about how they're going to try to run this bill and get this bill passed. Here, right here. Passage will signify that lawmakers deem the health care bill to be passed. There are gimmicks about passing bills. Maybe one day there could be an impeachment process. And basically, they're going to try to run this bill through. They're going to try to get it passed at your taxpayer dollars. And I'm going to tell you right now, if they do it, you think your Obama ratings are down low now, they're really going down low. And it's right now 9:01 a.m. Pacific Standard Time on a Wednesday. And I'm going to tell you that there are certain kinds of investments and there are certain kinds of things that's going to happen here. Pelosi and other congressional leaders pressed wavering lawmakers. They pressed them using these little bullet tactics. Is that the kind of people you want working for you in the White House? Okay? And believe me, people, what's going on here as how they're trying to sneak this in is called the up-down bill, and how they're trying to pass this bill. And let me tell you something else. There's a poll out right now for American people to come to grips on. You need to stand up for your rights and take accountability for you. And I can tell you one thing. Persuading the liberals to support a Senate bill is critical to the Democratic strategy, which has been written since January. And they lost their majority of their seats. And they know that this election at year end, they're going to lose a lot of Democrats anyway. And so this gives them another reason to pull off this little shenanigan about forcing this health care bill through there. But here, let me highlight some other things you don't know about outside of this document that we have here. And what the 1998 Supreme Court ruling was, and said that each House of Congress must approve the next same text of a bill before it become law. A self-executing rule sidesteps the requirement. Former federal appellate judge Michael argued in a Wall Street Journal paper. And what I'm saying is that they're really trying to pull off some stuff that they shouldn't be doing. There's going to be consequences. Here are some of the consequences. Your community, your healthcare community, the doctors have already come out in the last week or two and have basically said that half the doctors in America will quit practicing medicine. And the thing about it is, what these people are doing, there's nothing wrong with American citizens having health care. There's a right way, there's a wrong way. And everybody should be included for the most proactive bill that would be proactive and would help American citizens. And what's going on right here is not helping you. Not the way these things are being passed. And are you having any say-so about it yourself? The Tea Parties are in an uproar. We understand all of that. But what we would like you to do is to let you know that there's a big problem about this health care bill. Now, hey, people in the medical community are more disturbed than probably your Main Street. That's when you go see your doctors. They're very disturbed. There is a poll out that is saying that doctors across the United States will quit. They'll quit. and probably 30 more million more Americans will be shoved right into the system. But does the system work? I'm not here to go through all of that on this videotape, but what I am here to do is point it out. And the thing that I see is that things are not right, because they're not. And we're involved as professional traders in the stock market, and the thing about it is that forward looking, by doing what they're doing here, what is going to happen with the stock market moving forward? Something you might want to ask yourself. And how will that affect your investments? And basically, if you want to go to the Washington Post, this is where this came out. And there's a lot of truth behind it. And the thing about it is going to cause, if they go in there, sneak this in, and they end up forcing and passing this bill, what's going to happen is there's going to be a lot of what? Of what? There's going to be a lot of angry people in America. And it is, you think that the polls are, so, well, it's like this. So the Democrats know what they've been doing, and they think they're going to lose more seats at the year end. So what do they got to lose? They don't. They just throw it in there, pass it through. Who cares? The thing about it is, how will it affect you in the long run and your kids and everyone else moving forward? And you can see right here that the president leased out at Republican critics who have argued that the health care initiative would undermine Medicare. And he argued that the measure would end the worst practices of insurance companies. Look, like anything, nothing but another gimmick. Egos are involved. People are willing to go at any length to make these decisions that can potentially give you a very harmful effect. And I just want you to know that you need to be up to speed, and I'm sure that there are a lot of you that are. And it's pretty pathetic to see the kind of tactics that are used. Just like they use gimmicks and tactics in the stock market and on Wall Street. Now you're seeing government wanting control, willing to go at whatever expense to get their way. But is their way the way for you? Is it? Do you feel that they're looking out for your best interest? Do you? Answer those questions for me, and answer them for yourself. And the thing about it is, what will end up being the repercussions? What's going to end up happening? The tactic known as self-executing rule, deem and pass, has been commonly used, although never to pass legislation, because it hasn't. $870 billion health care bill. That number's wrong. Watch. A couple years from now, you'll see the truth. And this is part of the gimmick right here. The tactic known as the self-executing rule. All right? And Republicans quickly condemned the strategy. And you can't blame them. So basically, stay up to date. Watch what happens over the next week. See if this bill, your government, executing a rule. Deem and pass. No matter what. And one of three opinions that Pelosi said is that she is considering for a late week House vote. Okay? And I'm going to end the tape and I'll do another one.